Hello friends, well, this video is intended for candidates who've got no formal training in the UK and have been trained elsewhere. As a few of my subscriber friends have asked me whether you need a postgraduate qualification or you just need your MBBS or basic medical degree to appear for this exam. So the SCE website in the mrcpuk.org clearly states that you don't need a postgraduate degree to take this exam, which means that if you register on the website and if you pay the fees, you can take the exam. So that should be clear about this exam. Now, one of my friends asked me whether if he will watch all my videos and if he is going to study all the Q banks, whether he could pass the exam. Well, honestly, I don't know the answer if you ask me that question. Because I think the SCE has got a complexity of at least the Part 2 MRCP. I mean, it's similar or a bit higher than the MRCP Part 2 exam. So it doesn't depend upon whether you got a postgraduate degree or whether you got only your basic degree. It depends upon the level of knowledge you have and how much you can apply in a clinical scenario. So I can't guarantee that if you watch a few set of videos or a whole bunch of videos, and if you are going to do a lot of Q banks and if you're going to read a lot of books, I don't know how much you can apply this knowledge in the exam. So I got two strategies to take this exam. The first strategy was what I took, and I only studied for 2 months and maybe 2 months and 2 weeks. And what I did was that I went through all the Q banks first, and then I tried to skim the guidelines, and also I did some of the questions from the ACE website or ACE material which I got. So ACE means American Association of the Clinical Endocrinologists. So I did to solve those questions. So I tried to solve as many questions as possible and run through it one more time along with skimming the guidelines. And that helped, and I really enjoyed the exam when I took the SCE, apart from a lot of disturbance which I had during the exam because there was a lot of noise from the other room, which I've told you in my former video. So I really enjoyed the exam because I was thinking each case as a patient who is in front of me, and I was trying to solve that case. So I was thinking it in a realistic sense, and I was interested. So I think if you have got the interest and if you have the ability to solve the problem which is in front of you, because each of these cases will be presented as problems in front of you. So if you got the right problem solving skills, it will make you pass the exam. And the exam has got I guess the exam has got 3 sections. One is clinical knowledge. You need to know, you need to have an idea about how to develop a differential and how to management in the sense not only giving medications but alternatives to medications. How would you manage specific problems in specific scenarios? And for the majority, you're being tested in 6 areas like pituitary, thyroid, diabetes and its complications, bone, reproductive health, and the miscellaneous topics, which will include electrolytes, obesity, and all such stuff. So and the various, strange syndromes. So you need to have an understanding of all these before you appear for the exam, and you need to know how to solve these. Apart from the clinical knowledge and the clinical judgment, you will also be tested for novel concepts and novel, new research or new developments in this field. And you'll be given critical cases. You'll be given, and most of these questions will have two choices which are close together, and it will be difficult for you to, choose between these two. So that's how this exam works. And you would also be tested on physiology, biochemistry, pathology, and molecular biology, and pharmacology regarding these 6 areas. So this was my strategy, but I'll tell you why I'm not recommending this strategy, because I'll tell you about the second strategy. Well, the second one is like you read a standard textbook if you have time, like Williams, and then you go through all the guidelines, and then you try to make your own notes, and you try to correlate, and then you work on the Q bank, and then you go in the reverse order to your notes and try to find the relation between the questions in the Q bank and the notes, so that you have an idea about what's really happening. Or even if you have a patient about whom you can't solve, you always know where and how to look. Because once you pass this exam, if you are passing this exam just for an exam, whatever you've learned will end with the exam. But if you're going to work as an endocrinologist in the UK, or as a registrar in endocrinology in UK, you have to apply whatever you have learned in SCE in real life. So if you can extend your period of study to about 6 months or 1 year, making a firm foundation of what you're learning, that's going to help you, because this exam is not just merely for a certificate. It is to enhance your knowledge, and it makes you, it makes you ready to apply this knowledge when you need it. So it's a beautiful exam in a sense, even though it's a difficult exam, it's a beautiful exam, and it has got good value. I mean, it is considered to be very esteemed in the UK. Even if you apply for a registrar post or a specialty doctor post or an associate specialist, if you have the MRCP UK and if you've got the SCE, I mean, it's considered to be a very, very plus for you. Just based on that, the SCE past result in endocrine and diabetes, you may be selected for a lot of jobs there. So, but I would suggest you to take time and learn in a good way, so that you may be more focused when you have your practice. Now, when you start to work in the UK as an endocrine consultant or an endocrine registrar or an endocrine specialty doctor or whatever, you will know that you are given a mix of patients from not only from endocrine but also from the the general medicine intake also. So you have to manage both these limbs, and sometimes your endocrine practice may be very limited and you will have to do the general internal medicine mostly. So you might even not get time to revise these guidelines. So if you are going to be a good endocrine doctor, you need to know these guidelines and you need to know how to apply these guidelines. So just reading these guidelines it's not going to help you, but you need to know how these guidelines can be applied. So that's where the Q bank stands, and you have scenarios and you use your brain with your knowledge to apply this and to solve these problems. So in a nutshell, I would suggest to you to have some background knowledge before you start your Q banks and then apply for this exam. And you have got a mock test in the MRCP UK website, and if you can score 70% in the first attempt, that's not the second attempt, in the first attempt, I bet that you will pass this exam. So it could be a bit harder than what you have seen in the MRCP UK website exam too. So when you're really prepared for the exam, just give a try, and then you don't need to redo the exam again, because they're not going to ask the same questions in that website. So you don't need to do that again. But if you prepare well, at least for 6 months, and then apply for this exam, then do the mock test and then apply for the exam, I bet that you can pass this. So planning is quite important. And when I tell you 6 months, I would prefer you not to work if you just got your basic medical degree or your MBBS. I wouldn't prefer you to work, but you will have to at least study for 8 to 10 hours per day with sufficient breaks and with sufficient reinforcements. When I tell you reinforcements, you'll have to read what you have read again and again so that you won't forget. And of course, you got lots of videos now. There have been Dr. Khalid's videos, there have been mine videos, and there have been other videos too. So, all these are just signposts, and they've worked like, I think we are just guides to trying to direct your path. And it's not a substitute for your effort and your dedication and your perseverance and your hard work in this exam. I mean, that's what really counts. And how much you want to pass this exam, how eager you are to pass this exam, and how much you want, do you really enjoy when you solve these questions? Do you really enjoy the material? Do you really enjoy endocrine? If you can enjoy all these things, I bet that you can pass this exam. So that's all I wanted to tell you. It doesn't depend upon your postgraduate degree, it doesn't depend upon your MRCP UK, or it doesn't depend upon your whatever degree you have. You just need your basic medical degree to take this exam. That's all. I hope this video should be helpful for you. If you have any queries, you can always write to me at endocrinesce@gmail.com, or you can post in the comments. I have disabled comments in some of the sections because I see a few spam advertisements coming in, so some of them have disabled. So I don't want spam to come in, so that's why. So you can even write to me at endocrinesce@gmail.com, and probably I would reply you within a week or maybe 2 weeks. I hope this was helpful. Thank you, friends.